as Rachel said, to value, recognize, and reward us as educators. Do know that your institutions want to help you succeed as an educator and support you and your ongoing development in this area, and definitely demonstrating by these competencies and different metrics how you can be promoted at your institution. Welcome back to the Faculty Factory podcast, friends. I'm Kim Skorupski. On today's episode, we have Dr. Rachel Levine. Rachel is my friend and colleague in the Office of Faculty Development here at Hopkins. She's an associate professor of medicine and our associate dean for faculty educational development and the associate vice chair for women's academic careers in our Department of Medicine. Hi, Rachel. How are you doing today?
I'm great. Kim, thanks so much for having me on the show. I'm a huge fan.
Oh, thank you. Now, listen, you have a lot of history here in education at Hopkins. You have a heart and a passion for teaching. Will you please tell the listening audience, before we get into this, about our wonderful educational programming at Hopkins?
Sure. So we're very fortunate at Hopkins that we have a very long tradition of some really outstanding faculty development programs around teaching skills and other educational areas like curriculum development. So I've been really fortunate in the Division of General Internal Medicine to be involved with our longitudinal program in teaching skills. Now, this course has been around for 33 years. We have our 33rd cohort this year. And this course is really unique in that it's longitudinal. We bring together a small cohort of educators every week for a half day for a total of 21 weeks. And I've been involved heavily in the program for about the last 5 years. I've co-directed the program with my colleague, Dr. Leah Wolf. And this really, I think, is kind of the flagship of the institution. In terms of creating an educational experience for our educators that we think really fits the mold of what is most important in learning principles and experiences.
That's right.
Now, the thing about that program, some of the things that are wonderful about it, it brings together a really diverse group of educators to sit and be together for about 4 hours every week. We use teaching strategies that are really based on adult learning principles like a reflective practice, experiential learning methods. And so that's a great experience. The challenge is that we can't reach that many faculty with that course. As you know, faculty are incredibly busy and constantly tapped to do many things, and so there are not that many faculty that can commit a half day a week for 21 weeks.
Right.
And so to address that need, with in my role in the Office of Faculty Development that you mentioned as the Associate Dean for Faculty Educational Development, and with my partners in the Institute for Excellence in Education, Dr. Joko Francesco, we have built a suite of courses that can be delivered in half-day and two-day programming that deliver teaching skills to a much broader audience. So some of those courses include the Foundations of Teaching and Learning, which is a half-day course that covers the learning environment, facilitating small group sessions, feedback and coaching, clinical teaching, and active lecturing, and we deliver that in about 4.5 hours, and we offer that course 2 to 3 times a year. Mm-hmm. And we have also been building out a set of programs that match what we believe are the core competencies of educators at any academic medical center. Yeah. So I could tell you about that in a moment, or I could tell you about some of the other teaching skills programming.
Well, yeah, before you go into the competencies, because that's where I really think this is the meat of our conversation today, I did want to give a high-level view of some other programming you've developed and you've worked with. And I know some off the top of my head, of course, are the turning your everyday clinical activities into scholarship that Mike Barone and Jan Serwint worked with. And then you've taken that over. And I know the cool, fun stuff, innovative stuff you've started at Hopkins, had to do with,
Improv.
Oh my gosh, improvisation. Yeah. I mean, I took the acting classes and it just slipped away from me. But yeah, the yes and. So Rachel got one of our local famous actors to work with us, work with a lot of physicians on improvisational skills for building communication skills with patients and whatnot. So maybe talk about a couple of things just to give people little tidbits of the cool things you're doing.
Okay, yeah, sure. So with regard to improv, that's one of the innovations that I help to add to our longitudinal course in teaching skills. So we begin that course every year with an improv session. And then when we come back after the holiday break, we restart with an improv course. And we've used that exactly as you described, Kim. So we use that, one, to kind of build community in collaboration. So we use it as a team building exercise, but also there are so many skills related to improv that resonate with teaching. And that's been a really successful and fun addition to the teaching skills course. We have also used improv in our teaching camp course. So that I didn't mention before, but I can mention now, is a 2-day summer program that we offer every year for the past, I think we're in our 6th or 7th year now. I should check the dates on these. And we mix up the content every year, but we pretty much every year, every other year, include an improv session, and it is universally loved by participants.
It is so fun, and you're exactly right. It's just a way to really kind of get a group gelling together, because you're laughing and you're kind of loosening up, and you can immediately see the application to everyday life. Not even if you don't see patients, even if you're in a lab or with your family or friends or just colleagues, this idea of being open to ideas. So yeah, you're right. It's super fun. I'm so glad you brought it to us.
Yeah, and I look forward to trying to offer it in other ways for faculty more broadly, not just within the context of teaching skills. I think the other thing that we hadn't mentioned that I think is wonderful about improv, and also any faculty development that we offer that helps individual faculty build their skills, I think builds things like satisfaction, and certainly that links to things like well-being. And in a time where faculty are so stretched thin and the risk of burnout is so high, I feel like anything that we can do that can bring more joy to the work is really important.
Amen.
There's that piece. The other innovation that I want to talk about that you sort of mentioned that we do in our longitudinal course, and I would love to expand more broadly, is in that course, we have a peer observation of teaching with feedback and coaching component. So after the first half of that course, when we move into after the holidays, we come back. One of the things that we train the group of educators to do is be peer coaches. And then we have them sign up to be observed in their teaching by a colleague who's also taking the course, to be observed and then to get feedback on their teaching. And that has been such an amazing experience for participants, and then also as an educator, something I take a tremendous amount of pride in, and I wish that we could expand this to more faculty.
Yeah.
We're able to do this in a really nice way in the program because we have time set aside during our 4-hour sessions for the coach and coachee to sit down and pre-brief around the work that they're going to do. So the person who's being observed would share goals that they have for their teaching, ask for feedback around specific areas, maybe a strategy that they're working on or a potential challenge they might face, and actually observe that pre-brief happening. Then this pair goes off and they do their observation and they do their debrief in the group again so that we can observe that debrief. And so the coach has an opportunity to practice their coaching and feedback skills kind of live, and the coachee receives their desired feedback and kind of real-time problem solving and reflection right there in the course. So that's a really exciting program that we offer through that course.
That is so awesome. I love that not only for the coachee getting that valuable feedback and the group effect of learning from each other, but the coach, her or himself, that's another skill that they can put in their toolkit that they can then offer or think about teaching their trainees about the elements of good coaching. And so I think that would probably empower everybody, not only on the how to improve my teaching and be a better teacher, but also how to coach. So I think you got a double whammy there. So that's just such amazing work. I just love it.
Yeah, I think you're right. We spend time during the first couple sessions really talking about a coaching model and talking about those specific skills that you're alluding to, Kim. And we hope that we're creating a culture of coaching where it's really about performance improvement and less about, as much as possible, evaluation from a summative perspective. Because we know all of those issues do come up for learners and even faculty. And we really want to create this culture of improvement. And certainly, as you know, the coaching model is all about that.
Exactly. And coaching is so hot now. Everybody's all into the idea of, executive level coaching, which is now kind of filtering down the ranks where people appreciate life coaches. So that's kind of the thing. And I can definitely see how you could we could translate or crosswalk this coaching model around education to coaching in the research lab or coaching in departmental communications and the culture of how we communicate in faculty meetings or coaching around, anything, any kind of administrative or research work or program building work. I mean, all the basic elements of coaching, I think, could definitely be reproducible in any kind of arena. So building that culture of coaching, I think, is just, it's a hot thing, and you've really broken new ground, and I can't wait to see where you take it next.
Yeah, absolutely. And I think the other piece here that's really important to keep in mind is that we're encouraging peer coaching, right? So we know that there are not enough, professional coaches around to work with every faculty or trainee. And so really thinking about how you could be a peer coach or invite coaching from a peer, I think, is a really important skill for faculty to develop and, sort of build skills and expertise and all those things.
Yeah. And certainly more cost efficient and cost effective if we can train ourselves to do that. So you're right. Peer mentoring, peer coaching. Awesome.
Yeah. They're great skills to have, right? You can use them, as you mentioned, in so many settings, and definitely in teaching, which is, where my focus is.
Right. Yeah. What about these competencies? Get us trained up here. What are you talking about?
Yeah, so I think this will bring us back to your specific question about some of the other programming that we've developed. So I have had the great pleasure to be involved in a committee or task force here at Hopkins where we've brought together a really diverse group of educators. We've got clinical educators, basic science educators. We have experts in curriculum development and assessment and evaluation. And we've brought this group together to do the work of identifying in our local context what are the specific educator roles or activities or domains of work that we do? And the overall goal of this work has really been to create a framework for individual faculty to recognize where they need to build skill and expertise or mastery and how they might structure their career development in that setting. So for individual faculty, it would have that benefit. For mentors or division directors or whatever you want to call it, supervisors of individual faculty, it can help them be a better mentor to help an individual faculty create their career path, if you will.
Right.
And then hopefully from an institutional perspective, this work by identifying these domains of educator work and the competencies within those and the metrics for assessing those individual competencies from the institutional perspective, that would help us to better value, recognize, and reward educators. Mm-hmm. So that's kind of the overall goal of this work. And, this is certainly not something that's unique to Hopkins. The AAMC has been really engaged in this work. There was just a article in Academic Medicine this last week at the head of print from folks at Penn. I think Lisa Bellini is the first author who's an educator there that describes this type of work and really for similar purposes. And much of this work, I think, is driven by the fact that our educational, I guess what I would say is medicine is changing quickly and pretty drastically, and so the role of educators is really evolving. As you know, our own institution is expanding its clinical footprint because of the way that our trainees are trained, which is also a competency-based approach. Much more of the teaching is shifted away from time efficient models like lecturing and actually pushing learners out into real work settings. And so individual faculty are needing to be skilled in educating in many different settings and requires many different skills. And so that is much of the reasoning behind why we are trying to create this framework, again, to help drive what we do in faculty development, to recognize what are the skills that we need to train our faculty up in, and think about things like workforce, and as I said, how can we really acknowledge all the amazing work that our educators are doing and hopefully reward them as they should be rewarded. So that's kind of the background of this. And so I mentioned our amazing committee, but what we've come up with is a model that really has 6 major domains. And the reason that I want to tell you a little bit about these is because we're using this framework of these 6 domains to then create faculty development offerings. And I think that's pretty exciting. So just to kind of orient you to how we have framed this work, the 6 domains are teaching and facilitating learning. The second one is mentoring, coaching, and advising. The third is program and curriculum development. The fourth is assessment and evaluation. The fifth is educational leadership and administration. And the last one is educational scholarship. And so the work that our committee has done is that within each of those domains, they've come up with a set of competencies. And then we're doing the work now of identifying metrics that you would use to demonstrate that someone is doing an outstanding job in one of those areas. What I like about this framework is it helps me as a faculty development person recognize what types of programming we need for our faculty. So, for example, I think that we've got teaching and facilitating learning pretty well covered. As I mentioned, we have a longitudinal course. We've got a 2-day teaching camp that the content changes every year, and we get folks from across our institution, regional, and last year we had individuals coming from across the country to our 2-day teaching camp course. And then we also have our half-day courses that we offer. For program and curriculum development, we have a really robust curriculum development, faculty development program that's led by Belinda Chen, Dr. Belinda Chen, and there is a longitudinal course similar to the teaching skills longitudinal course where individuals or groups of individuals come to that mentored longitudinal course with a idea for a curriculum and then go through the curriculum process from soup to nuts, if you will. Her team also offers 2-day, half-day curriculum development programs. And in an effort, so my dream, Kim, is that for these 6 domains, we would have a foundations course for each one that would be offered at least once a year. And so our faculty could make their way through these half-day workshops that would be considered foundational, and ultimately a faculty person could have a certificate to demonstrate that they have participated, if it was their interest, in all 6 of those domains, and that would be meaningful for for example, for a promotional package to demonstrate that they are participating in continuous professional development and improvement.
Right.
So, for example, in addition to having a foundations course for teaching and facilitating learning and curriculum development, we have, as you mentioned, we've morphed the turning your everyday educational work into scholarship. We've morphed that into now we have a half-day workshop called Foundations of Educational Scholarship. And again, it's foundational, but it provides a really nice overview for participants about what makes medical education research unique. It takes our participants through, how to come up with a good question and problem. We have representatives from our information services there to lead individuals through, things like literature searches. We bring in a panel of faculty who have been really successful in medical education research to talk about their path, to talk about resources and opportunities for grant funding. And then we have opportunity for individuals and groups in that half-day course to share their ideas and get feedback with some experts that we've brought in for that day. So we offer that typically about twice a year, and we're in, I think, about our first year of offering that course. And so we'd like to continue to build the foundations courses to include mentoring, coaching, and advising, assessment and evaluation, and actually medical education leadership. So we're in the process of working on those, using this framework that we've spent a lot of time talking about and thinking about to turn that into a useful product for faculty by creating this series of half-day workshops.
Love it. Unbelievable. The competency domains, has this been presented nationally, and are we working to get this across the other medical centers and adopting this, because you mentioned a certificate. So is it currently we're not really standardized in the way we're thinking about this across the country, or is it pretty much matching up with other institutions' competency framework structure?
Yeah, so that's a really good question. So I think what we're experiencing both here at our institution and then nationally is definitely over some time a movement to create a framework for educators. So I mentioned the AAMC has, a group on faculty affairs, has done a lot of work on this, beginning probably in the mid-2000s, and they've published on this. And there are several other individual academic medical centers and schools of medicine who've at least published similar work. And I think that what this demonstrates is that every sort of institution is facing similar pressures, right? So, moving education and teaching into many, many different areas, many sort of frontline educational roles, the need for many more well-trained teachers, and this competing pressures of the clinical productivity that we all know we're facing. And so I think every institution is recognizing that and trying to come up with a way of, supporting educators, supporting quality education, and also recognizing the work that educators do, rewarding and promoting educators or clinicians for this work. And so different institutions have created different models, but they're very much similar if you kind of look what's out there. The other thing that I think is driving this is that we know that our accrediting bodies, so for example, the LCME, which accredits our medical schools, does require that institutions show evidence that faculty are being trained in teaching skills. Mm-hmm. And while faculty are not required at this time to demonstrate competency in teaching skills, an institution is required to demonstrate that these faculty development in teaching skills programming is being offered. Right. And so that certainly in the future may evolve. Mm-hmm. It's possible that could one day be a requirement that individual faculty demonstrate either participation in teaching skills programming and faculty development, or potentially even competency. Mm-hmm. I don't know what that would look like. I don't think any of us know. But it's something to consider as potentially down the line. But I see this work that we're talking about here as foundational to addressing where we're going in medicine and medical education, and what potentially could be required of faculty in the future. So to summarize, the answer to your question is individual institutions across the country have been doing this work. There have been national groups like the AAMC who have been doing this work. I think in most cases the frameworks overlap pretty consistently. I think individual institutions are doing the work on their own as well, because as much as our institutions are similar, they're very different as well. And so local institutions need to really determine what teaching looks like at their institution, how you might measure teaching at their own institution, how you might demonstrate, excellence in teaching. So there will be a local component at every institution, but I think the framework has face validity across institutions.
Yes. Well said. Well said. That's really good point about the accrediting. And so if you're listening out there, let's, keep in mind we all work in universities. Universities are, institutions of higher learning. So education is part and parcel of what we do. So the fact that, these frameworks exist not only for accrediting, but just for our own growth and development, and as Rachel said, to value, recognize, and reward us as educators, do know that your institutions want to help you succeed as an educator and support you and your ongoing development in this area, and definitely demonstrating by these competencies and different metrics how you can be promoted at your institution. So I guess if your institution, I know many of the institutions do, have these resources as Rachel talked about, but if you don't and you want to learn more about what we do, for example, at Hopkins, we do have this great resource that Dr. Levine mentioned, the Institute for Excellence in Education, the IEE, has a 2-day summer camp. We'd encourage you to come and learn from that. Or I'm sure Dr. Levine wouldn't mind communicating with you offline. Her email address is rlevine3@jhmi.edu. Again, that's rlevine3@jhmi.edu. You can find out some more about her on the Faculty Factory website. That's facultyfactory.org. But again, there's a lot going on in this space. As Dr. Levine mentioned, it's moving fast. It's we're really up for some pretty big changes, but there's new technology, new learners, new styles. So it's a really hot, cool place to be. And I just want to thank you, Rachel, for spending some time with us. I learned a lot, and I'm sure people out there are excited and encouraged to, really, recognize how important the education is, and know that there are people out there like you who are thinking about this and working hard to help us with our skills. So thanks, Rachel. Anything else you want to say before we stop?
I want to say thank you. This has been great. I really want to end with, I love how you're ending in such a positive way. I really agree. I see this as such an opportunity. What gets me really excited and what I'm most passionate about is thinking about how people learn and how, as faculty, we can do a better job in our teaching, how we can design our sessions or activities to really build on the strengths of our learners and also fit best with the principles of learning. I get super excited about that. So I'm really thankful. I feel really fortunate that I'm I'm at the right time in the right place for all of these, sort of changes, even though they're bumpy and they're challenging. I really feel like it's going to make education better and potentially has the opportunity to really create a lot of joy and satisfaction for educators.
Yeah, well, and we are so fortunate to have you and doing the hard work you do and your passion for it. Maybe you'll come back on the podcast and talk about the work you do for women, and we can talk about our women's leadership course. Dr. Levine and I have put together a 2-day leadership course for women physicians and women faculty that we've offered at Bogota, Colombia. Again, I want to give thanks to Rachel Levine, my friend and colleague, our Associate Dean for Faculty Educational Development here at Hopkins, and thank you for tuning into the Faculty Factory Podcast. Talk to you next time. Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more. Get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.